Hey, welcome to the Go-To Physio Sports Massage series. Today we're going to talk about the calf, the soleus, the posterior soft tissue techniques. My favorite techniques that I've used in pro sport and in private practice. As always, please respect the 80-20 rule with sports massage. Understand that this is just treating the symptoms, so to speak. If we want to get lasting changes, I know your patient might feel great leaving, but if they keep coming in and things keep tightening up, please go through a graded exposure of the true cause of the problem. If you want to know more how to find that, head over to thegotophysio.com. I've got plenty of tips there to help you find that. So without further ado, let's get into my favorite soft tissue techniques for the posterior calf, for the soleus, for tib post. You can treat many different symptoms like that. But as always, the most important thing is we get that graded exposure to the true cause, which is specific to the patient's story, which you find in the subjective assessment. I'll see you on the other side.
Okay, so for the posterior leg, what I usually like to do is I would personally like to just put the leg resting on my own quad, okay? So what I can do here is I like to put my hand here, soft knee, okay, and again that allows me just to generate a lot of tension through here, so I can sink into the tissue, and then I can get some nice pressure here through Pete if I want to. Or the other thing is I can use my fingers, okay, so again I can sink, I'm going to get that elbow tucked in, okay, and I'm just going to push through the tissue. Obviously I would have oil here on when I do that, but you know, you can get some nice depth here, and if you want to get you know, some maybe specific portion of the leg, then you can bias that maybe a little bit more with your fingers as well, okay? But as I said, for the majority of people, forearm will be able to get into that tissue as well, and once you get used to it and you sink through it, you can get quite a nice bit of depth here with that as well, okay? And again, I'm in control here, I'm talking, I haven't even broke a sweat here, you know, I'm getting quite deep into Pete's posterior thigh here with very little effort. So again, it's not you know, it's not an awful you know, lot with me. And again, like, don't worry about your back. Once your knee is soft, my pressure's going through my foot here, and I've got good intention in my foot, my back's absolutely safe. I'm flexing at the thoracic spine, but the thoracic spine is built to flex, you know, so is the lumbar spine to a point, okay? So, you know, I'm very comfortable here because I've got good force through my foot, got good force through my hand, I'm distributing with my force well, you know, and I can get some good stuff into that. Okay, and again, then obviously for the peroneals, we can do the same. I would just go up here, okay, or I can even go here, so I can put my hand here, stabilize, and then just get some good force through that tissue there. Or if I wanted to with the peroneals, Pete, if you just pop on your side facing the camera, okay, then just put a cushion, okay, so if I just grab a cushion, again I will put a cushion here, I'll put my hand here to support, and then I can just go through here quite nicely, okay, so again I just sink, and then I'm just going to go through, and again my left foot is pushing my body weight through, and my forearm is just reacting to my foot. I'm not trying to do this, it's a whole body movement, and again I'm almost pushing through the tissue and getting that nice depth. Same with tibialis anterior thigh, we can do that as well quite easily in this position. Or if I wanted to be a little bit more specific, then I can do it with two hands. But as I said, for the majority of these, if we can use our forearm, then great, you know, I'm a big fan of that if I need to use that.